assessing a patient who's a 35-year-old female. She's called the ambulance for a bleeding nose. She was playing rugby when she was hit in the face with a rugby ball. As instructed, has been holding her nose sitting forward, holding the fleshy part for the last 15 minutes. It is still bleeding when we get there. Her primary and secondary survey is clear with no abnormalities. She's not lost any consciousness, has no medical history, not on any medication. She has a GCS of 15, and yeah, we're just about to come in and introduce ourselves. So hi, my name's Julia, I'm from St John Ambulance.
Hi Julia.
Can you tell me what's happened today?
I was just playing rugby and I hit my nose on someone else.
Oh, that's no good. Okay, I'm just going to get my partner to take some vitals and they come back all normal, so that's actually quite good. All your vitals are normal. We're just going to get this bleeding fixed since you've already done this for 15 minutes. Okay, so I'm just going to draw up some adrenaline. So I'm drawing up 1 in 10,000 adrenaline by diluting 1 milligram of adrenaline to make up 10 mils. With the saline, I'm going to give you 2 mils into the bleeding nostril. I see it's just coming out of your right nose there, so we're just going to give you 2 mils into that one size. We'll use it with this mucosal device here. Okay, so while I'm doing this, I want you to just slowly blow your nose to clear any clots. So not too hard, okay? Okay, so my partner's done all the drug check on my vial of adrenaline here. And I'll check that it's not expired, and it's adrenaline 1 mg and 1 ml. Okay, so I'm just going to get this ready for you. Are you alright there? Got a sharp spin, just put that in the sharp spin over there. Okay. So I've already got 9 mils of saline here, and I want to put in 1 mg. We're just going to pop that down for a minute. These are a bit tricky sometimes. Okay, so I'm just going to draw that up. Okay, put that away in my sharp spin. Take this off and put that in my sharp spin. Okay, so I've got my mucosal device here. Let's make sure there's no air bubbles in there. Okay. Okay, so I'm just going to put this up your right nostril where it's bleeding. Okay, it's gone up there. Okay, so now I want you to just lean forward, and same as what you were doing before, pinch that fleshy part of your nose. Okay, so just while we're doing that, we're just going to ask a few questions. So is your vision okay? Can you see how many fingers I'm holding up here?
Yeah, 2.
Yep. Have you got any spots or anything funny by your eyes? I'm just going to get my pupil torch to have a quick look in your eyes. Okay. They're both equal and they're both reactive to light, so that's pretty good. Okay. Have you got a headache at the moment?
No.
Okay, well that's good. Have you been drinking any alcohol today?
No.
Or take any other substances?
No.
That's good. Okay. Just going to get my partner to take another set of vitals. We've been sitting here for 15 minutes. It's looking pretty good. The bleeding's stopped now.
Cool.
Okay, you feeling a lot better?
Yeah, heaps better.
Oh, good. Okay. So I'd like you to go and see your GP within the next couple of hours. Is that possible for you to do that?
That's cool.
Okay.
You can take me.
Okay. So just we just check off a few things before we leave you to make sure everything's okay.
Yeah.
Haven't got any red flags in my procedures here because there's none for epistaxis. Okay. What I'd like you to do is actually get up and walk over to there and come back and just tell me if you feel nauseous or dizzy or anything like that.
I feel good.
And the bleeding hasn't started back again?
No.
That's good, so you've mobilised. Okay, so I'm going to give you this piece of paper. It has an ACS number on it, so you can go home and print off and look at everything we've written about you. I'd like you to also take that into your doctor.
Yeah.
Okay, you can hand that over to him as well. And I'm just going to write down all the advice that I've told you about going to see the GP.
Okay.
I'm also going to hand you over this concussion sheet.
Cool, thank you.
So sees that were hit at rugby,
Yeah.
just in case you develop any of the signs of concussion. You know, feeling dizzy or nauseous or slurring your words or feeling really sleepy, anything like that, look for this sheet. You call 111 if it gets worse.
Will do.
So you're alright with that?
Yeah, happy. Thank you.
Okay. Stop. Okay, today I've been dispatched to a 16-year-old female. Chief complaint, she's complaining of a headache. She's been at school athletics today. It's been a hot day and she's been running lots of races today. I've taken her vital signs. All her vital signs are normal, except she has a slight temperature of 37 degrees. The pain, she said, has just come on slowly over the last hour, and it's throbbing all over. It doesn't radiate anywhere. She describes it as a 6 out of 10 pain. She looks hot and flushed, and she's not complaining of any nausea or vomiting. She says that she does not have a history of migraines and no family history of migraines, no history of cerebral events or intracranial bleeding in her or her family. She's had no recent falls lately, and when I examine her, I can see that she has no rashes. She's not itchy, anything like that. So she has no medical history, she's on no medications, and she's not allergic to any medicines. Today she's been eating normal food, but she hasn't been drinking much fluids, and she's been running a lot on this hot day. So I observed the patient to walk normally earlier on, and the patient has consented to this video and this assessment. Okay, first I'm going to open up some windows just to get some cool air in. I'm going to get you to take your jumper off because we want to try and cool you down a bit. Okay, we'll probably get a drink of water as well. I just need to do a few assessments on you. Is that still okay? Okay, can I get you to poke out your tongue for me, please? It's nice and moist, that's good. Okay, have you got any pain in your neck? Can you go like this? Up and down? Any spots or dizziness? Can you see how many fingers I'm holding up? 2. Okay, that's good. I'm just looking at her skin. There's no skin tinting. Her pulse is normal and regular. So that's really good. Okay. I'm just going to do what we call a fast test. So I just need to have a look in your eyes. Okay, so I'm just checking to see that they're equal and reactive. Okay, looking in both your eyes, they're both equal and reactive to light. Can you give my hands a squeeze, please? Squeeze my hands. They're both equal. Can you please smile for me? Okay, that's good. Now I want you to hold your hands up like this and put your palms up and shut your eyes. That's really great. Okay, so the fast test is clear. Okay, so you know what day it is today?
Sunday.
Sunday, you know where you live?
8 Lighthouse Street.
Okay, she has a full GCS, so that's good. Have you had any alcohol or any other substances today?
No.
Is there any chance that you could be pregnant?
No.
No? Are your periods all regular?
Yes.
Okay. Have you had any abdominal pain today or any chest pain?
No.
Okay, that's good. Okay, so you don't feel dizzy when you go like this?
No.
And is the light bothering you at all?
No.
Okay, so I'm just going to double check that there's not any rashes and things on your back. Okay, I can't see any signs of rashes. That's really good. Okay, I'm just going to palpate your spine to make sure you haven't put your neck out, and that's what's causing your headache. You just tell me if that hurts when I push down here. No pain?
No.
Okay, that's really good. Okay, so I don't think you need to go to hospital. Okay, but I would like you to go to the doctor. Can Mum drive you in?
Yes.
Mum, is that okay? Yep. Okay, that's good. So what we're going to do, just think that Charlotte needs to go in and see the doctor. If she's still not feeling very well, I think she needs to be hydrated, have lots of fluids. But just go and get it checked out anyway.
Yeah.
Doesn't hurt to have a check-up. Yeah?
Yeah.
But if you get worse, so if you start feeling nausea or vomiting, or any spots before your eyes, or you get confused, so you understand that, Mum? Yep. And you understand that?
Yep.
You call us back on 111, and I'm going to write all these instructions down on this piece of paper for you. Okay? So, got a few more checks just to do to make sure before we decide if we are going to leave you at home. And I'd like to give you a little bit of pain relief for your headache.
Yep.
So you're not allergic to any medicines?
No.
Have you had any paracetamol or anything containing paracetamol in the last 4 hours?
No.
Okay. Alright, so what about ibuprofen? Have you had any of that in the last 4 hours?
No.
Okay. So I think just we'll give you some paracetamol and ibuprofen.
Yep.
Okay, so how much do you weigh?
50 kg.
50 kgs? Okay, so you can have 1 gram of paracetamol and you can have 400 milligrams of ibuprofen. Okay, so here we go, there's some water, if you can swallow those. Takes about 20 minutes to take effect, okay? Alright, that's good. Okay, so just take another set of vitals and they will come back normal. In fact, the temperature's now come down to 36.5. What's your pain at the moment?
About a 3.
About a 3? Are you just feeling better because I'm here? Yeah? Okay, well that's good. Okay, what I want you to do is I want you to get up and walk over there and walk back. Does that make your headache worse or do you feel dizzy? No, that's good. Okay, and just before we go, I'm going to quickly run through my red flags in my book just to make sure that that's okay to leave you at home. Okay, so you haven't had any neck manipulation lately? You haven't been to the chiropractor? Your neck's not sore? So it's not a very severe headache and it's come on gradually, so it's not sudden. You haven't got a temperature greater than 37.5.
Yeah.
You don't appear to have any flu symptoms. You haven't vomited. You know where you are and what's going on. Have you got any numbness or tingling anywhere?
No.
No. You don't have an altered level of consciousness. You haven't had any recent falls. You're not on any anticoagulants because you're not on any medicines. You haven't got any signs of temporal arthritis. You're not pregnant. No history of intracranial bleeding, and no cerebral vascular abnormalities in the family. Okay, and it didn't happen while you were having sex. Okay, so orange flags, sinusitis, have you got a blocked nose or a cold or anything like that?
No.
No, and you haven't got a migraine, and you haven't had one before. So I think you're actually okay for Mum just to take you into the doctor.
Yeah.
So Mum can make that appointment for you later. You may even just come right on your own with just a bit of rest and some fluids. Okay? If it gets worse and any of those signs that we talked about, I want you to call us back on 111. So here's a little sheet. So you can look this up on the computer for my report. Okay? You can take this into the doctor, give that to him as well so he can see. And here's another sheet with the signs and symptoms to look out for because of your headache.
Thank you.
Thank you. Right, hello. I've been called to a 40-year-old male chief complaint, lower back pain in his lumbar spine. It's 8 a.m. and he says he was just trying to get out of bed and he felt a twinge. He normally suffers from chronic back pain, but today it's worse than usual. After questioning the patient, I've learnt that he has no allergies. He does take paracetamol regularly for his back. He has past medical history of chronic pain in his back and he has hypertension. He describes the ache as a dull ache. It's non-radiating, doesn't go anywhere else. It's not it's only provoked by when he moves a certain way, and nothing really makes it better. It's described as a 5 out of 10 pain. Usually he lives with about 2 out of 10 pain. All his vitals are normal. He comes back with good pulses, good pedal pulses, good radial pulses. And when I assess him, I find that the pain is in his back and as well a lumbar here. I've assessed his abdo. He has no abdo pain. He's got no altered sensations, no pins or needles, no tingling or loss of sensation. He's not complaining of any rigours, and he tells me he hasn't had any unexplained weight loss recently. He has not lost control of his bladder, and he says he's not had any recent falls. Okay, I just need to have a look at your spine. Is that okay? Do you consent to me doing this assessment and things for the video? Okay, so I'm just going to feel down your spine. I'm going to start up here. I'm going to push down here and you tell me if it hurts. Does it hurt down here?
A little bit.
Okay. I'm just going to have a look at your spine. I can't see any bruising or obvious discoloration or any lumps or bumps. Okay. Have you had any trouble with your urine or your bowels lately?
No.
No, that's all been good?
No, it's been good.
Haven't had any fevers or anything like that?
No.
Okay, that's good. What I want you to do is I want you to stand up for me, please. Does it hurt when you stand up?
Well, it's not too bad.
Not too bad now? Okay. Are you able to walk in a straight line just along here, please? Okay, that's good. And come back. Just get you to lay on the bed for a little bit. I'm just going to just lay back that way. Can we get you to lift your leg up? Does that make it worse?
No.
Can you push against my hand there? Okay, this one. Lift it up. That's okay?
Yep, that's okay.
Okay. Alright, so you normally go and see the doctor about this sort of thing?
Yep.
Has it ever been this bad before?
Oh, it has its moments.
Okay. Well, I can't see that there's any serious injury on this, but you know, I think you probably need to go get it checked out.
Okay then.
It might be that the doctor recommends you go to the chiropractor or something like that.
Yep.
How about we get you some analgesia, some pain relief underway?
Yep.
So you normally take paracetamol, so have you taken that this morning?
Yes.
Yep, okay. So and then that's, what time was that? So it's 8 o'clock now.
About 7.
Okay. So I can't give you any more of that because it's in 4 hours.
Okay.
Okay, so, and you're not allergic to any medicines?
No.
Okay, what I can give you is ibuprofen. Have you had any of that in the last 4 hours?
No.
Anything else containing ibuprofen?
No.
Any coughs or cold syrups or anything like that?
No.
Okay, have you had tramadol before?
No.
Okay. Might make you feel a little bit, it's morphine based, might make you feel a little bit lunar possibly, but we'll hang around just to make sure that you're okay with it. You
Okay.
okay taking some ibuprofen
Yep.
and tramadol?
Yep.
Okay, so I'm going to give you 600 milligrams of ibuprofen because you weigh, how much do you weigh?
140 kilos.
Okay, so yeah, so you're allowed 600 milligrams of ibuprofen.
Okay.
And I'm going to give you 50 milligrams of tramadol.
Yep.
Okay? So you're not pregnant, so that's pretty good. Okay.
Well, I hope not.
You're not allergic to it, you haven't had it in the last 4 hours. You know where you are today and what's going on?
Yes. Yeah.
Yep, so you're not confused yet and you're not dementia or anything like that.
No.
So here we go, here's the pills.
Thank you.
Okay, my partner's been checking them for me. They're not expired, they're intact in the packet. They're all pretty good really.
Okay.
Okay?
Yep.
And my partner's read it back to me and told me
Okay.
the same thing. It's not expired.
Okay.
Okay? So we just want to look at sending, I don't think you need to go up to the ED.
Yep.
Okay? But
No, yeah, we're right.
I think you should go and see your doctor.
Yep.
Can you get into the doctor and make an appointment today?
Yeah, and I did it.
And can someone drive you in there?
Yep.
Yep. Oh, that'd be good. Okay, but before we do that, I'm just going to run through some red flags that I have for lower back pain,
Okay.
just to make sure that I'm on the right track. Okay, that we don't want to leave you at home when we shouldn't do. Okay, so looking at red flags, if you've not lost any control of your bladder,
No.
your vital signs are all normal, you don't have a temperature, you've not got any rigours, you haven't got any pain further up your back, so that's a good thing, it's all lower down. No abdominal pain, no altered sensations. You can walk in both legs,
Yeah,
everything's fine there. Don't seem to have any illnesses, just seems to be, that's the reason you sort of just probably twinge something. Okay, so is there any pain radiating down your legs at all?
No.
Okay. Do you have a history of cancer?
No.
And you're not on any medication, so you can't be taking any chemotherapy or steroids. Does it get worse when you lay down at night? Seems to get worse when you stand up,
Yeah, I don't
rather
stand
than
up.
when you lay down. Yeah. Okay. Do you have a history of osteoporosis, or do you use drugs?
No.
Okay. So that covers everything. So what I'd like to do is give you this sheet of paper.
Yep.
Okay. So if it gets worse, and if you start vomiting, or the pain increases where you can't move, or you get any altered sensations in your legs or anything like that, or pins and needles, I need you to call 111 back.
Okay then.
Okay. So I'm going to give you this little piece of paper. I've written down all the instructions on that.
Yep.
And we'll call up and make an appointment with your GP. I'll do it with you here now if you like.
Yep.
We'll get you in. Sometimes it helps if we call.
Yep.
Okay. And since you've got somebody that can take you, and you're okay to sit in the car?
Yeah.
Yep. Okay. So that's pretty cool. So I'm going to give you this sheet of paper. Two pieces of paper. This one's a sheet that's got a little number, and you can go into the computer on this website. You can see everything I've written about you. I want you to take it into your doctor as well.
Yep.
Okay. And this other sheet of paper is just all the things to look out for, those red flags that we talked about for your back pain.
Okay then.
Okay?
Yep.
Alright, thank you.
Thank you.
Bye.
Okay.